Welcome to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, a faculty member at Johns Hopkins and also a former health commissioner in Baltimore City. Until now, our sole focus has been COVID-19. We are broadening the podcast to other urgent public health issues, beginning with racism, police violence, and the national protests over the homicide of George Floyd. In this episode, I speak with Professor Daniel Webster and Assistant Professor Cassandra Kerfasi of the School of Public Health about the homicide of George Floyd in the context of their research about distrust in the police in Baltimore and beyond. Let's listen. Dr. Webster and Dr. Kerfasi, thanks so much for joining me. I want to start with the killing of George Floyd. When you saw that video, what was going through your mind?
For me, it was among the most cruel and horrific things that I've seen. And the other thing that was going through my mind was that the nation was watching this, and particularly Black people who have had a lot of bad experiences with police that very clearly devalue their lives, and that this would be among the most powerful ways that could be demonstrated, a total disregard for George Floyd's life. And despite the pleas from the man trying to breathe, but also from onlookers. So to me, it underscores what's been a problem for very long, but in the most, again, dramatic fashion that I think maybe any of us have seen.
Dr. Kerfasi?
For me, that video evidenced the callous disregard for the health and safety and well-being of Black and brown bodies that many communities experience on a daily basis. This video really captured a lack of respect for individuals in this community, that someone could just simply snuff out a life like that without anyone feeling like they could step in and interrupt that situation. And this is something that many communities, although not at such a intense degree, but this is something that many communities feel on a daily basis when they interact with police. Now,
you've studied the perceptions that communities have about the police. How did your research put this in context?
So we've been gathering information around community perspectives for police for many years now at the center. And often what we hear is that there is a challenge that communities struggle with, feeling like there is a lack of transparency and accountability when they interact with police. They have very little role in the process, and they feel that there's no recourse when they're treated with disrespect or when something negative happens in interaction with police.
And particularly in Baltimore, what have you found?
Sure. So in Baltimore, most recently, we gathered a couple hundred surveys from East and West Baltimore, 100 in each neighborhood that experiences high rates of gun violence and also struggles with interactions with police. And while many of the respondents reported significant concerns around people having illegal guns in their community, they also doubted the capacity of the police department to properly arrest and stop those individuals who are actually driving the violence. And this just led to further mistrust.
So even though there was maybe a high rate of gun violence in their area, the police really weren't seen as part of the solution.
They were not seen as part of the solution. And often the way they were interacting with communities in these areas of high violence, there could have been contributing to more violence by having disrespectful interactions, eroding that trust such that community members don't feel comfortable coming to the police and sharing data. And that can contribute to the poor case closure rates that we see in Baltimore, particularly for homicide and non-fatal shooting. And this then feeds back into the loop where communities don't feel safe, and they're more likely to carry an unlawful gun themselves, out of safety or fear, the need to protect themselves. So it just becomes a vicious cycle.
So as you did this research, how did people perceive what could be done? Maybe I'll ask you, Dr. Webster, in this situation where you have high levels of gun violence and a profound distrust of the police, what did people say needed to be done?
Well, they said two things very clearly. One was that the enforcement needed to be really focused on the relatively small number of individuals in the communities that are driving violence. That was the first strong point. The second strong point was that there really need to be, in essence, a quality control process that is a partnership between state prosecutors and the state's attorney's office, very carefully reviewing the cases that are come forward with illegal gun possession to make sure that searches are done in a legal manner and that officers are not fudging evidence in any sort of way. So those were the two things, and they wanted actual both internal and external data showing that those kind of issues are being monitored, how police are going about the important business of addressing illegal gun possession.
What do you think real accountability looks like for police? I mean, I think part of what you're talking about here is accountability, and it's probably a little bit more than just, posting numbers on a website somewhere. Like what do people talk about in terms of what needs to happen?
Well, I'll mention something, but I'm going to cast a jump in here as well. I think they want to see when officers are violating the laws, violating the Constitution, the constitutional protections against illegal search, for example, that there are actual consequences for that, for the officers involved, and that there is accountability by supervisors to address that so it doesn't happen. So that's most importantly, I think what they're looking for is they've seen for too long that officers get away with things that they shouldn't be getting away with. And so there needs to be accountability at the officer level, but also accountability at the management or supervisory level.
Dr. Gafasi, what policies make that possible?
I think one of the challenges with police departments, and not unique to Baltimore, but many other police departments as well, is a challenge with data tracking and quality. So let's say I make an arrest as an officer and I log my paperwork. As far as I'm concerned, and many police departments are concerned, we're done with that and we move on to the next case. But what we don't know is whether there were issues with that case. Did I do an illegal search? Did I have insufficient statement of probable cause to initiate that interaction? And if that case gets dismissed by the state's attorney or other prosecutors, very often that information is not fed back to the police department. And this information is key for two reasons. One, maybe an officer or a unit needs additional training so that they can write a proper statement of probable cause or better articulate what they were looking at. But also, if there is sort of an early warning system or a flag that there's a problem with an officer, it's going to come out when there are repeated dismissals of cases because of an illegal arrest or other officer behavior. So we really need to think about who is tracking this data and how it's being shared back with police, really as a starting place. And we heard that from community members in Baltimore. Many of them said that their trust in the police department would increase if the state's attorney was reviewing body camera footage, for example, to see if there were any issues to better identify problem officers early on.
Well, what do you think the current attention to these issues is going to do in terms of making some of those reforms happen around the country?
So I think the death of George Floyd really highlights that even progressive departments who are dedicated to changing policy and changing behavior can struggle. There are opinions in departments that may be more old school. There could be challenges in working with police unions to really hold officers accountable. But I hope that the death of George Floyd will highlight many of these challenges and identify opportunities for improvement. I really think this report can lay some of the groundwork for departments that are looking to improve both their ability to arrest individuals and hold them accountable for using guns in violent crime, but also do it in a way that is fair and effective and respectful of their community.
Dr. Webster, any final thoughts?
Well, I'd like to say that there actually is research available showing that police departments can reform on a number of matters, including officer use of force, and that the research shows that that translates into fewer civilians being killed by law enforcement. Look, this is not an easy thing to do, but it can be done. And law enforcement has gone about it in different ways. But fundamentally, they have to change the rules at which they are, that in essence, that their officers must adhere to. And so I think that's what we're going to be doing in the days, weeks, and months ahead, is really looking at what are the deep reforms that need to be made in policing. And one connective piece here with the broader research on lethal use of force by police officers and our report, which is focused enforcement, one of the key determining factors of these lower rates of lethal use of force is lower arrest rates for minor offenses. So there are a lot of data, ours included, that all point to we need less heavy-handed enforcement for more minor laws that are less consequential to community safety, so that you can focus on what the real root of the problem is in communities suffering with very high rates of homicides and shootings.
Great. Well, thanks very much to both of you.
Yeah, I have one more thought.
One more?
I wrote this down and I wanted to be sure to say it. You don't have to use it, but I think it summarizes nicely. Okay. So one of the things that comes out in our report and when we have heard from other communities is that community members want a police department that is responsive to their needs. They want the police department to be in service to their community. They want to be transparent about their activities, and they want them to be accountable for their actions. And if we can get to a place where police departments are prioritizing service, transparency, and accountability, I hope that we can start to address many of the flaws that exist in our police departments across the country.
Great. Thanks so much to both of you for joining me.
Thanks.
Happy to be here.
Thank you for listening to Public Health on Call, a new podcast from the Johns Hopkins Bloomberg School of Public Health. Please send questions to be covered in future podcasts to publichealthquestion@jhu.edu. This podcast is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Lamare Morales. Audio production by Niall Owen McCusker and Spencer Greer, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.